the skin, the rheumat, the mental, and we're going to the dental. 32 teeth at a time. So less. So it's less important. That's what comes out in the patient's mind. Yeah, 5 or 10 less. It goes on. Start. Diabetes and oral complications, which is the most neglected part of diabetes. I don't always use PowerPoint. I'd been a professor and head. I used to be an academician turned clinician, but when I do, I'm always interesting. History of diabetes, which has been told, is 1550 BC. After that also it has come down, and people used to have this condition, which shows in the literature of history all over the different civilizations. Coming to 10th century AD, Abyssinia, living in Arabia, they recognized people used to ants to test for diabetes by presenting urine to them. That was a way initially when nothing was available. Yeah. Today, in 2025, somewhere in Mumbai in 2025, I would like to tell you, hey, Miss Katie, where are you going? Just going for a diabetes. Means I just want to put it up that our endocrine is being taken care of by a kitty as well as dogs, pets. They are getting endocrinologists who takes care of the pets. And in Ahmedabad, somewhere in Ahmedabad, when I am checking my patient and I ask him, "Shu tamne diabetes che?" And they will tell, "Ha, thodo thodo che." You understand? That is the common. We have been empaneled with central government. I know you have been working with the private setups. Yeah, I have been working with central government, Army, PRL, ISRO, ONGC, IIM, Western Railways, ESIC. So seeing the mass and the class together. Okay, and that's where the difference comes up. So we get shocked. Patients are comfortable. Oh, thorough diabetes che. So, and we humans are questioning the basic diabetes protocol. So I'm not ill, my pancreas is just lazy, and this ultimately leads to the oral complications and other complications which has been emphasized by my previous speakers. The most common, dry mouth xerostomia, you would have heard the term, yeah, which reduces salivary flow and changes in salivary composition can lead to dry mouth. Dry mouth itself makes it very difficult for the patient with lack of saliva. The bacterial activities within the oral cavity increases a lot and ultimately leads to many conditions. Bad breath. Diabetes and bad breath, which is a common, because of dry mouth, automatically the patient, the breath is badly affected. And that ultimately leads to many other conditions, even what we call it as infections of the oral cavity and increased decay activity. Why? Because once the salivary flow is decreased in the oral cavity, the bacterial, the carbohydrates which are fermented. See, in a layman term, when you talk about decay, what is a decay? It's a carbohydrate fermented in the oral cavity, which ultimately leads to the production of acid, which ultimately decays the tooth and gives a more favorable environment for the bacteria to thrive. So decay is one of the most common of the above two conditions. Yeah, and that ultimately leads to why decay is one of the major diseases in the world, but no vaccines has been found till now, because the bacteria which is found on the oral cavity has got direct correlation with the heart. We have heard about subacute bacterial endocarditis, yeah? So that is the reason why no vaccines have been still found for that, and the only prevention in dentistry is the cure then. Yeah, either you prevent it or you cure it. There is nothing in between. Once the decay has taken place, no medicines, no antibiotics is going to treat it out. The most important, which Indians, I would say, out of 10 people, 5 to 7 people are suffering, is periodontal disease, the gum disease, yeah? The periodontal breakdown is most commonly found in the patient suffering from diabetes. And these conditions, patient will come to a diabetologist with normally complaining of bleeding gums, and he feels that, oh, I would have got blood cancer or something like that, you know, but that he comes to a general physician or a diabetologist for this purpose, yeah? And then you have to diagnose this out, that this is bloody, not taken care of the oral cavity, not going for the cleaning of the teeth. Because the common myth which we find in dentistry is that I got my teeth clean and my teeth are loose now, yeah? So I'm not ready to get my teeth clean. But actually, the thumb rule is every year you need to get your teeth clean. If you don't do that, then ultimately, over a period of 10 years, if you go and you clean the whole thing, it's going to be loosened up. So every yearly, the protocol all over the world is 6 monthly, but for India, I would like to suggest that it should be yearly. Again, most common conditions, wound healing. Wound healing in the oral cavity has been delayed. I'm just trying to bring to your notices to all these things, being you are all diabetologists are working in your fields, so that at least when the patient walks into your clinic, you can be aware of it and send them to a dentist for the routine checkup. Oral thrush, fungal infection. Nowadays, this has, after the corona epidemic, this has become a very common thing which is seen in the patient's mouth, oral thrush and infection. Stress itself, other conditions, everything leads to fungal infections and ultimately leads to the formation of the white scar, a white layer of thrush on the tongue as well as on the buccal mucosa. The most, again, autoimmune disorder, oral lichen planus, yeah. Oh. Oral lichen planus, yeah. Oral lichen planus has been an autoimmune disorder, but diabetes itself is considered to be one of the culprit in which patients come down with this. Before they get development of other lesions on the body, in the skin, in the legs, this is a common thing which we see. The speckled bands in the oral cavity, which can be differentiated very clearly from pemphigus or leukoplakia and other things. And there, and the frequency, like I have been practicing from 1998, and today, after 2015, I have been seeing a lot many patients coming down with these conditions with increased stress and diabetic conditions. And corona, well, it opened the gateway to the most disturbing mucormycosis. Never heard of, never thought of, and dentistry was on a epicenter of getting new things done, new kind of surgeries, all coming down because of mucormycosis. We have seen these things in diabetes, taking steroids in corona, and this has ultimately led to a major things. And now, even after the corona has passed away, we find patients who are coming down with mucormycosis. We diagnose them, we need to send them for the radical therapy into a big super specialty hospital, but they come into the dental clinic with these conditions presenting to us. Another condition known as burning mouth syndrome. This is a painful neuropathic condition you are all well aware of. Neuropathy is one of the side effects of diabetes. And when it happens in the oral cavity, the patient finds very difficult to eat. A person would be very enjoying the chilies and all other spicy foods. And then he comes up to us with, oh, I cannot eat all these things. But he doesn't realize, no medicine, nothing, no multivitamins can cure it out. But diabetes itself is the sole culprit which has to be taken care of. And then you get the results. This is a case just before 2 days where osteomyelitis and diabetes, the patient is just 2 days, yeah, and he diagnosed, he just got a simple extraction done, but with a chronic diabetes and uncontrolled one, got into this osteomyelitis condition within the period of 3 months after the extraction of the tooth. It was so fast, patient doesn't represent any signs and symptoms, yeah, to the clinician, went to the Tata Memorial Hospital and then came down to be osteomyelitis. So what to look for as early sign of diabetes in the oral cavity, yeah? So one of the most common things, if the patient has got bleeding gums, patient has got gingivitis or periodontitis where the gums are crossly or chronically inflamed. One of the reasons for this happens is one of the condition is the bacteria, and that is because of diabetes. So all these conditions, as you have seen on the screen, you can make it out: halitosis, oral infection, gingivitis, altered taste and xerostomia, tongue abnormalities. This all can suggest sometimes the first signs where the patient is undergoing a diabetic condition within which has been hidden and he has not been able to be diagnosed. Yeah, so all these conditions can provide us the early signs. Sometimes we send the patients to the diabetologist that, boss, you are having something unusual and you should get your diabetes checked, particularly when the wounds and the lesions are not healing in the oral cavity. So key is to maintain blood sugar level and good oral hygiene. We doctors also don't do all these things. Yeah, but twice brushing in the day and the night is one of the most important parameter for everybody. Okay, so brush and floss, control your blood sugar. These all things are very important in today's era. Yeah, with the amount of stress taking the toll on the human beings. You see, obesity runs in my family. Is it because nobody runs in my family? In your family, yeah? This is the common thing which is happening. You might have heard of Jamtara, Vantara. Now be ready for DiaObecon. Yeah, that is the new thing which will, I love your, that's all. Thanks a lot.